Hello, today I'm going to talk about tuberculosis, also called TB, one of the major One Health diseases globally. And today I'm going to show you how human, animal and environmental health can be interconnected in the transmission of that disease and for fighting it. My name is Sandrine Le Cellier and I work at the French Agency for Food, Environmental and Occupational Health in France. So TB is an old disease, but it remains one of the deadliest infectious diseases worldwide. As you can see on the graph on the left, it is among one of the world's leading causes of death from a single infectious disease, and among the top 10 causes of death. It is present in all countries and age groups, and it is estimated that about a quarter of the global population is infected with tuberculosis. We talk about 10 million people falling ill every year, and in 2024 we had 1.23 million that died from tuberculosis, with among them a lot of people with HIV. And you can look on the right the fact that TB is represented in all age groups, including young infants, and mostly adult males tend to be more infected than females. So TB has a human health impact that is very large. Unfortunately, it contaminates people mostly with high level of malnutrition, poverty, overcrowding, HIV. You can see on the graph on the left that is correlated with low level of income, GDP, and high level of undernutrition. It is mostly prevalent in Africa, Indonesia, India, also in Mongolia, found in South America, Groenland. It is a disease that developed in only about 5–10% of people infected, and the symptoms are well known, with a persistent cough, sometimes coughing blood, lots of fever, a lot of night, and loss of appetite, weight loss, lots of fatigue. And it is lethal. About 50% of the people developing the symptoms, if they are not treated, they will die. We know more and more about the level of transmission of mycobacteria in people and also in animals, as I'm going to show you later, through a range of diagnostic tools ranging from culture. As you can see on an example on the top right, mycobacteria growing on a specific medium. It is highly specific. Once you see the culture, you're sure about the result, but unfortunately it takes a very long time to grow. It can take months. And also it requires biosafety level laboratories that are not available everywhere. Therefore, there are new techniques that are being developed to found mycobacteria in people and animals, especially in those where we have symptoms, and also radiographic images showing infection of the lungs, as you can see on the graph. One way that is non-specific but very rapid is to look at, through a microscope, stainings of mycobacteria. It is very rapid but non-specific. What is very specific is to look at the genes. So there are systems that are being developed by the side of patients, such as the Cepheid Gene Expert and TrueNat, that are mini PCR that can be deployed in the field. And more, what is really powerful to look at the type of mycobacteria that is in contaminating people and animals is through the whole genome sequencing. Once you have the mycobacteria that is growing by culture, you can analyze very completely the genome of mycobacteria, and then follow the clustering and the transmission trees, between people, but also between people and animals and the environment. Looking at the genes as well, you can detect and identify very clearly the type of mycobacteria that is infecting people and also animals. So when we talk about tuberculosis, in fact, it's through mycobacteria that belong to a Mycobacterium tuberculosis complex. That's Mycobacterium tuberculosis, but also Mycobacterium bovis, Africanum, Pinnipedii, Microti, Caprae, Canetii, Ovidis, and probably there will be others that will be detected and identified. And you can see the range of animals where these mycobacteria have been identified, and I've just shown several pictures. There are many, many other species where you can identify these mycobacteria, and they are everywhere in the world. So I've shown you a map of Europe with the examples of the wildlife species where you can find Mycobacterium bovis, but in fact you can find these mycobacteria from the Mycobacterium tuberculosis complex all over the world in species that belong to the canids and felids and many ranges in animal kingdom. Unfortunately, these mycobacteria can then be transmitted back to our cattle and to us people. And this is why the World Organization for Animal Health classified mammalian tuberculosis as one of the WOHA listed disease, and every case must be reported to WOHA so that overall we can understand better the risk of transmission between the different compartments of infection, animals, environment, and people. Just talking about Mycobacterium bovis, it was estimated by the WHO that about 147,000 new cases of zoonotic TB were existing in people, and that's mostly in Africa. But clearly this figure is underestimated, and also because it's not only Mycobacterium bovis that is contaminating people, it can also be others. And one example is Mycobacterium ovidis that has recently been identified and isolated. And the more you look, the more you find. And it's now been detected in 14 different countries across 5 continents and 17 host species with a high risk for human people. So the good news is that tuberculosis is a bacteria and it can be treated with antibiotics. So the treatments that are recommended by WHO are quite heavy. It mostly includes, the most important ones are rifampicin, isoniazid, pyrazinamide, and ethambutol. It requires daily uptake of pills for 4 to 6 months. But the good news is that most of the people that are treated can be cured. Therefore, it's really important to identify the infected people as soon as possible. And also to be sure about the type of mycobacteria that is contaminating people, because some of these mycobacteria, unfortunately, have developed resistance. We talk about multi-drug resistance TB, and it is quite widespread across the world, as you can see on the map, with numbers of people, number of cases that can be really high, for example in India. And it's very important to identify the zoonotic disease transmitted from animals, because mycobacteria, for example Mycobacterium bovis, can also develop sometimes natural resistance to the antibiotics. For example, Mycobacterium bovis is naturally resistant to pyrazinamide. Therefore, it is really important to be able to identify when a patient is infected with such bacteria. And unless you apply the right techniques, you will miss it. So these mycobacteria can be transmitted between people, but also between people and animals, and from the environment. Between people, it is well known that tuberculosis can be transmitted through the aerosol caused by coughing and sneezing, and it's mostly causing a lung disease. That's from Mycobacterium tuberculosis mostly. However, it is more and more recognized that a lot of patients also developed extrapulmonary tuberculosis. And in that case, it comes from oral contamination, and that's typically what can be acquired through contaminated raw milk from infected cattle with Mycobacterium bovis. Did you know that consuming raw dairy products can cause tuberculosis? And this is because infected cows typically, or it can be also goats, or it could be bisons or buffaloes, producing, when animals are infected, their milk can be infected. And if you consume this raw product, you will acquire Mycobacterium bovis and be infected with tuberculosis. And also from the soil, from the environment and water, because the mycobacteria are very resistant bacteria and can survive for a very long time in the environment. So I told you, the cattle, for example, or herds with goats can be infected with mycobacteria such as Mycobacterium bovis or oryges, and this disease can cause weight loss, reduced productivity of milk and meat in animals, therefore have very high economical consequences in the farming industry in all the different countries. And this is highly important in the smallholder farmers in areas where there is already poverty and vulnerability. And what is very important to understand is that these bacteria, that is difficult to diagnose, can be shed a long time before the clinical signs develop. Therefore, represent a real threat for the environment and other animals in the same herds, and for people living close to the animals or being in contact with the lesions, for example at the abattoir. Therefore, it is very important to educate people and the public about the risk of transmission of TB from animals and try to control TB on a global scale, taking into account the transmission from animals and the environment as a One Health disease. This is why the World Health Organization, the World Organization for Animal Health, and other large organizations have launched a call for actions against tuberculosis. Because it is possible to protect ourselves, the public, and people living and working with animals against the transmission from mycobacteria that is contained in infected people and environment. This is by strengthening the biosecurity measures, preventing the transmission between animals, and I will talk about it a bit later, and also by controlling animal movement. But it's also through trying to destroy the bacteria and try to prevent the transmission from animals to people and also between animals. So typically, it is important not to drink raw milk, but to pasteurize it. And this is for people, but also for the calves, drinking the milk from the cow. And this is possible through pasteurizing the milk, by decontaminating it through exposure to high temperatures. It can be done on an industrial scale, but also at home, just by boiling the water and boiling the milk. When you have the meat from infected animals on farms, at abattoirs, at the butcheries, and also with wild games, because I showed you some wild animals also can be contaminated with the mycobacterium. It is important to protect yourself and also to destroy this mycobacteria by cooking really well the milk and not putting this infected meat in the food chain, removing the contaminated animal product. And it also, once some animals are identified through the carcass, it is important to identify which herd they come from, so that the in-contact animals, and sometimes people, can be quickly identified. Acting this way, identifying animals that are infected, and that can be done on dead animals, as I showed you at the abattoir, looking for sometimes lesions, but also looking at the response of animals before death to the mycobacteria. This is possible by injecting some product from the mycobacteria called tuberculin. When you inject it intradermally and you look at 72 hours later, if animals have been in contact with mycobacteria, they will develop a swelling. If this occurs, this is a very good sign that the animals have been sensitized and very highly likely infected. If such animals is identified, it is important to remove it. And one way is to remove it by killing it, so that we can be sure it can stop transmitting the disease. Another way to identify the infected animals is through the blood. You can take the blood and stimulate the blood in vitro with the same antigens and detect a response by cytokine response interferon gamma. And this helps identify animals that have been in contact with mycobacteria. The systematic testing and removing of individual animals is one way that in France the TB-free status was reached in 2021, and this highlights the importance of this approach. In spite of difficulties, as you can see on the graph on the left, that the level of incidence, that is the red lines, that has decreased up to 2021 but is now increasing again, is the difficulties of controlling TB also in wildlife around the herds and also between the herds, because it is so difficult to diagnose, and the spread is insidious and continuous. So it's very, very important to have an adequate local legislation and to apply a very intensive surveillance on the farms, and also apply a very effective traceability and movement controls. Also, biosecurity is important to avoid the direct or also indirect contact with wildlife. And another way is to try to control infection in wildlife, and I'm going to talk about examples in several slides later. Another point I wanted to make is that although the antibiotics treatment is possible against TB, and it is of course applied in people, it is highly recommended to avoid antibiotic treatment in animals. Although sometimes it is carried on in precious animals, such as it's been reported in giraffes and some elephants sometimes. In pet animals also it is not conducted generally. And this is very important to try to develop antibiotic resistance in these mycobacteria, so that the antibiotic treatment remains efficacious for people. Another aspect about trying to prevent the transmission of tuberculosis is using a vaccine. And this was developed in Europe, in France actually, about 100 years ago. The BCG, the Bacille of Calmette and Guérin, is one of the most widely used of current vaccines, with millions of doses that have been deployed. It is highly protective against meningitis and disseminated TB in children, so that's very good news. But unfortunately, it does not prevent against primary infections in adolescents and adults, especially in the less developed countries. And also it does not prevent reactivation from latent pulmonary infection. Therefore, it is really important to support research so that new vaccines become developed. And currently we have 18 candidates that are ongoing clinical trials including 6 in phase 3, so there is hope. This vaccine is currently not allowed in cattle, and the reason is that the diagnostic tests can become falsely positive in vaccinated animals, because we are lacking very accurate what we call DIVA tests that can differentiate the vaccinated from the infected animals. There are trials, research trials, to try to establish, though, new diagnostic tests, new DIVA diagnostic tests in cattle in different parts of the world, including in the UK, where I'm showing you the level of prevalence is high, and the spread of the tuberculosis in cattle has been really high since the 80s, as I'm showing on the map on the right. And although in cattle it is not recommended, vaccination is a tool that is attractive for wildlife, because in that case it is less important that some animals become positive to the test if they are vaccinated. And this is to try to prevent the spread of the mycobacteria from wildlife to cattle, and try to protect cattle themselves from the transmission from wildlife. Therefore, one example is the licensing of BCG in European badgers in 2010 in the UK, that is delivered by injection. But coming back to people, of course, the main objectives is to address the transmission of TB, and including zoonotic TB, from cattle and wildlife and between people. And therefore, a roadmap has been established to try to reach the most important objectives and reduce the risk to people. So I hope you're convinced that it is really important to improve the scientific evidence base. The level of infection of people must be established, identifying exactly which mycobacteria is contaminating people. It's also very important to produce a safer food so that people don't drink, in particular, contaminated milk. And this is very easy to address by pasteurizing the milk. It's also very important to improve animal health, removing the infected animals and preventing the transmission to the rest of the herds, and that way reducing the risk to people. Reducing the risk is very important through education, increasing awareness, engagement and collaboration, so that at all levels, from the public to the politics, everyone engaged into developing the right tools to protect people. So through all these efforts, major advances in TB diagnosis and treatment have been reached. And thankfully, reaching people that are infected early enough, applying the treatment has saved a lot of lives. It's been estimated that 83 million lives have been saved since 2000. Access to treatment is really important, and trying to also decrease the level of drug resistance TB is another very important objective. Developing new drugs to treat people infected with this drug resistance TB. Another way as well is to deploy preventive treatment to the people at risk. So these are in contact people with TB patients or HIV patients. But unfortunately, treating TB and meeting the end-TB strategy target by 2035 is not always the highest priorities of the politics. And unfortunately, we've seen a fall in the funding for fighting TB. It was estimated that we needed about $22 billion in 2027, and only a quarter of this money is going to be available. So you can imagine the impact in the deployment of a treatment, the level of a treatment, and the deployment of the diagnostic tests across the world will be impacted, of course. And unfortunately, it is estimated through modeling that if this continues, up to 2 million additional deaths is going to occur that could be prevented between 2025 and 2035. So this is not a fatality, and hopefully through all these awareness on One Health diseases and the importance of TB for people's health across the world, there will be support so that we can reach a point where TB can be eradicated, controlled in animal population and really well controlled in people, so that we can prevent as many deaths as possible all across the world for a healthier world. Thank you very much for listening, and I'm happy to take questions.